We're going to go over the Fit3D report. This is how to read your report. You'll get this sent to your email, in which case you can log in and access. You get a whole 3D imprint of yourself there. Again, these are all, if this is your first one, this is a good way to see your beginning steps and then measure yourself over time, which is really cool. So the body shape rating here, this is just a score of your overall body shape. And why this is important, it is looking at overall health risks and any type of potential for cardiovascular issues, diabetes, things like that. And what this score really looks at with the body shape rating is it's looking at really, if you're shrinking your waist, you're going to get a better score. So it looks a lot at waist and waist to hip ratio. So you'll see here that this is green, that if you're in the green, that's ideal. Yellow is average, red or orange needs improvement. So you can see where your score compares. And this compares you to millions of people that have taken a Fit3D score. There's one done every 20 to 30 seconds according to Fit3D, and that's around the world. Waist circumference, this is looking at your overall waist. Why this is important is this: the larger your waist is, the more likely you have deep or visceral fat. That's fat around the organs that can lead to health issues such as cardiovascular disease, diabetes, cancer, things like that. Again, green is good, yellow is average, orange or red needs improvement. Waist to hip ratio, again, you click on this, go over here, and you can see if you're in the green, yellow, or red, and green being good. So ideally, what we look for most people is to be below a 1 is what I say, but then you can see based on your age and factors that can change slightly. Shrink to leg volume. So you can see here for me, I'm in the orange. I'm at a 1.7. Ideally, we want to see this closer to a 1. So in this instance for myself, putting more muscle mass on my legs would help to improve my score here. With most people, as you improve the muscle mass on your legs and decrease the size of your waist, that's going to improve. Body composition. So this is how much body fat that you have, that it calculates. Overall weight, fat mass, and lean mass. Lean mass includes muscle tissues, skeletal mass, and water weight. So looking at those numbers there. And the body fat percentage on what is ideal is going to differ between men and women. And it's also going to differ based on your age and everything like that. Again, following this graph down here is what you can do to see what's ideal for you. Fitness level, this is roughly how many calories you burn at rest without exercise if you want to maintain your weight. So general rule of thumb is if you are tracking and you want to lose weight, be under that number. If you want to gain weight, over that number. However, adding exercise can influence that a little bit. Posture, so this is looking at your overall posture. So if someone is dealing with back pain, neck pain, shoulder pain, hip pain, any type of issues, this can be really good to see. Are you shifting? You can see I'm shifted quite a bit to the right. And I believe during this time I was dealing with some back pain there. So it'll show you from the front as well as to the side. So are you leaning forward or not? You can see my head is a bit forward along with my shoulders, and then from the back. And you can definitely see I'm shifted to the right there and tilted. So next is the balance. Ideally, you want 25% of your weight in each corner. A lot of people put their weight in their heels. If you are leaning more towards one side, it can indicate, are you favoring that side for some reason? A lot of times it's due to an injury. Your inches, so this gets good inch measurements all across your body. And this is really good for then when you want to compare. So if you look for here, I can go to comparison and I can compare my previous measurements. You can see I've had quite a few different measurements here, but we could compare one to the other. And then if I am moving, you can look here, body shape and body composition on how that varies. So when you have multiple scans, you can do a side-by-side comparison, which is really cool. So that is how to view and read your Fit3D score. If you have any questions, please let us know.